I, like Francois, thought I was going to have a little more time, so there might be a couple of things I have to go through a little bit quicker, but after this is the panel. My colleague will be on the panel to answer all your questions, and a lot of this comes from the paper that will follow in the ICRP proceedings. I did not do this on my own, of course, and these are all the people that contributed either directly or indirectly to the content of this presentation. And veterinary use of radiation has been around as long as we've known that there's been radiation. And in fact, Rankin was really good friends with a veterinarian. Professor Eberlein was the chairman of the first and second radiological congresses and the only veterinarian to have been so honored. And this image is actually from 1896, which is pretty crazy that you can see such elegantly detailed anatomy. This chameleon was not alive at the time. This wasn't made by veterinarians. This was actually made by artists exploring the use of radiation and film for these images. But as mentioned by the lecture by Liz Ainsley a couple of days ago, this, even since 1896, shows the benefit of collaborating with artists. And radiology specifically in veterinary medicine gained in popularity with small animal practice in the 1930s, and in general it wasn't considered a big deal. Time-distance shielding, there wasn't a lot of this type of exposure, so the doses were assumed to be low. It wasn't ignored or unnoticed, but it wasn't a true priority. But then from there, we have diversified considerably from planar films to CT, and then now a wide range of nuclear medicine and radiotherapy procedures. And so that means, because we have this diversity of procedures, that we also have diversified radiological risks. Very similar to what we saw, or the risks in human medicine. And there are also some unique aspects of veterinary practice that would influence the dose, both to the animal patients and to the humans taking care of those patients. And the figure there is dose to pet technologists. The top line, the blue line, was veterinary, and the bottom line, the red line, is human patients. A lot of different animals are diagnosed. In the left picture there, it's super tiny little guinea pig that's white and brown getting an examination by a C-arm. There's a cat getting a nuclear medicine procedure in the middle picture, and then there's a sea turtle on the right-hand side about to get a CT. So there's a whole range of animals that are diagnosed and treated. And not only in the medical context, but there are some other uses of radiation as well for performance, selective breeding, body condition, etc. There has been renewed interest, I guess, over the past decade or so. The number of professional literature publications has gone up, a variety of reports, one from ICRP in the United States, ARPANSA in Australia. The IAEA currently has a draft safety report that's pretty much ready to go in its last stages of review. And then it's a pretty active topic in Europe as well. And I just wanted to highlight this quote, since this is a patient-focused session. At the very bottom, it is also important to avoid all unnecessary irradiation of the animal patient. And this is one of the few instances, there may be others that we're unaware of, that my colleagues and I have found specifically addressing protection of the patient. The ICRP initiatives, Task Group 107 was to look and see if should we consider the animal patient, and they said yes, we should. That should be incorporated when the ICRP develops its more refined guidance on protection in veterinary practice. And then from Task Group 107, we have Task Group 110. This is currently the active task group, looking at occupational and public exposure of humans, considerations for the animals, as I just had mentioned, potential impact to the environment from nuclear medicine, and then also the ethics associated with that. Where does veterinary medicine fit within the current system of radiological protection? So we have occupational exposure, public exposure, and medical exposure. I put not occupational or medical, those are like air quotes, not like a direct quote. That pretty much public is the catch-all. And so some of the veterinary exposures might have an obvious category, but if we think about patients, really the publications developed on radiation protection in medicine are thinking about human patients. So what are the implications then for animal patient management? Where are we supposed to get guidance? And then for carers and comforters of animal patients, how do they fall? And so then that leads into the approach by our regulatory authorities. Are they supposed to treat this as medical, or are they supposed to treat it as industrial? And so there's a variety of different strategies in different countries. And how the regulators manage this exposure also can influence how the veterinarian is able to interact with their patient. Ethical principles, we haven't done a lot with this yet because we're in the early stages of development, but in general, we are looking at this One Health approach, and I like this figure, this interrelationship between animal health and well-being, human health and well-being, and then environmental health and sustainability. That's expanded a little bit to what they're calling One Welfare, so that's broadened to include specifically socioeconomic development, biodiversity, to contribute overall to sustainability. And so this is from what we're going to draw our ethical values as a supplement to some of the principles and values that Francois mentioned earlier from publication 138. So some unique aspects of radiation protection in veterinary medicine. Conventional radiology is very common in veterinary clinics, but my veterinarian back home in South Carolina has a mobile practice as well. He has a little cart that he hooks on the back of his car, and he goes around to different dog shows to take x-rays, radiographs of the dogs there looking for hip dysplasia. So that's something that's reasonably common now as well. The more sophisticated radiology, CT, C-arms, they're still widely available, but less common than conventional radiology. A lot of these devices might not be put in a place they were specifically designed for. So for example, if you're a conventional radiology, maybe your beam is aimed down, but if you have a C-arm, maybe the shielding on the walls isn't exactly what you would want. Mobile radiographic equipment, as I mentioned, not just for dogs, farms, stables, auctions, that's pretty unique. So here, the top image is one such leaded gloves, but in the bottom, oh, we don't have leaded gloves. Our faces right here. Also, I would be remiss if I didn't mention that these horses, they're bred to be fast. One, they're very expensive. They're not bred for temperament. And so you also risk getting kicked by the horse, right? So it's not just radiological concerns in this as well. But Unsir said, kind of as we mentioned earlier, that the doses should be low, but if you have poor practice, this exposure can accumulate. Nuclear medicine, again, not so common, but there might not have been full consideration to patient or waste contamination and management. And then other radiotherapy treatments like external beam, for example, again, they're rare, but they're certainly still out there. And then again, since we're in the patient-focused session, paper from 2017, despite the advancement of technology for treatment delivery and medical record keeping, misadministration errors have a significant impact on patient care and veterinary oncology. So we do really need to consider the patient in these procedures, as well, of course, as the humans involved. Secondhand equipment from human medicine, is it quality controlled? Is there the expertise in the veterinary clinic to do that? And then some of the safety requirements may not meet standards we know from human medicine. One of the examples a colleague provided is that some of the mobile equipment is being marketed as, oh, it's lighter, you can carry around, it's easier, it's less burden on the body, but then if you've reduced the weight from 6 kilograms to 4 kilograms, perhaps some of that was shielding that's been cut back. So again, we're interested in the potential for that to generate unnecessary radiological exposure. A lot of veterinarians have training on standard radiologic equipment and basic curriculum. So that's the, bare bones associated with that in terms of radiological protection. But there are striking differences between countries, between clinics, between schools, and to how to apply different imaging and therapy modalities. In a survey from 2018, this was in the United States, I'll let you read that, but 34% of those surveyed did not know what ALARA stood for in veterinary oncology. So that needs some refinement. Justification and optimization. So justification, in humans there are referral guidelines or clinical imaging guidelines. There aren't any in veterinary medicine. This may also explain why I mentioned earlier that there are some procedures that aren't medically indicated for suitability. Horses are very common. So here's a paper, How to Interpret Radiographs of the Carpus and Tarsus of the Young Performance Horse. And this isn't just anybody, right? This is a veterinarian, a diplomat of the American College. So there are some techniques, but no specific guidelines as far as what the dose would be. And I think I have it highlighted. Yeah, a set of sales x-rays are made up of 36 images of major joints of all four legs. And so again, if you have a horse that's misbehaving, some of those you might have to do again if you don't get a good image. And then if a horse is sold multiple times, they don't trust the first set of x-rays. They'll do another set. In terms of balancing risk and benefit, again, there's not been, besides radiotherapy, there's not been a big concern for the animals exposed. And this is just anecdotally, both Lodewijk and myself have gotten this response a lot, is that, oh, well, the dog's not going to develop any stochastic effects because radiogenic cancers take 10 years to develop. But that's in humans. That's not in animals. We would expect, proportionally to develop cancers similarly in animals as we would in humans. Maybe rate of cancers might be different. Like in elephants, they have extra copies of P53, so their cancer rate's lower. But we would still expect, proportionally in terms of lifespan, cancer development. The levels of justification, we can use that in veterinary practice as in human medicine. So for level 1, does proper use of radiation in veterinary medicine do more good than harm to society? So now, yes, we just generally agree as a society that this is the case, so level 1 is taken care of. Level 2, does a specified procedure improve diagnosis or treatment of a defined group of veterinary patients, or will it provide necessary information about the exposed animal? So this one is what we're talking about with like the suitability of performance, a suitability for breeding, not medically indicated. And then level 3, does the application of a radiological procedure do more good than harm in the management of the individual veterinary patient? Examination costs used to kind of limit the use of ionizing radiation, but now there's health insurance for pets, so it's more frequent. In some cases, there are mixed motives. So in the case of the horses, generally that's economic. But in terms of dogs, I mentioned earlier, and hip dysplasia in the United States, I'm not sure what the program is in other countries, but if you have a purebred dog that you would like to breed, that you would like to show, generally they need a health certification, and so you can go to this website. They have a lot of data about which breeds require which examinations, and a lot of breeds require radiographs of the hips and even sometimes other joints as well. So in this case, if you're looking for hip dysplasia, maybe there's some health benefit to the patient if you identify something that is potentially causing pain in the patient, but mostly it's for economic reasons. Financial benefit to the practitioner. So if you have a new piece of fancy equipment, you might have a tendency to refer the animal for a procedure that might not be absolutely necessary. So that's what we mean by self-referral. Competition between service providers. And veterinarians frequently refer to themselves not as a service industry, but something along those lines, very service-oriented. And so you want to please your client, and you also want to keep your client. And so there's some, maybe your client really wants a CT, and so they'll do a CT. Or maybe just to make sure they don't miss anything, they'll CT the whole animal, even if there's just a concern like in the nose or the head. There's also some issues with companies that have invested in the equipment and then have leased it to veterinarians, and then so there's some pressure from the company for return on investment. And so veterinarians may feel pressure to perform these procedures to make that company happy. This is a personal experience from Lodewijk. This is at a teaching hospital. I hid their faces just in case someone knew them. This is the veterinarian, right, behind the horse? Yes. Oh, he's holding the plate. He's standing right in the beam here. So that's the first thing. But the second thing, looking at the images, cervical spine, and Lodewijk put this in air quotes, lumbar spine. This is nothing. Right? This is not really lumbar spine. And he even asked the veterinarian, well, you know, with the energy of this, did you expect? And the vet was like, no, but I knew he probably wouldn't say anything, but I thought might as well as not, was effectively his attitude. Optimization. So again, we're focused on radiological protection, but veterinarians have a lot of different occupational challenges. So when we're you know, they say when you're a hammer, everything looks like a nail, so we really want to nail in on the radiation protection, but of course we can't forget that there's a lot of other things that we're dealing with as well, and we need to make the recommendations as practical and doable as possible, and also work with veterinarians, and we have several on our task group to make, to basically take this challenge and come up with a solution that's good for everybody. And this was written by our veterinarians, this practical ALARA with practical animal welfare, economic, societal, and environmental factors. So they just broadened a little bit on the idea of optimization that we see in publication 103. There's also, this is an initiative in the United States on lower the dose, another example of where we are thinking about exposure to the patient. And then this is working with members of the veterinary community, and it's the idea that if we lower the dose to the patient, we still get excellent image quality. We, of course, want to maintain that image quality, but that's better for the patient, and it's also better for the staff. And so that's kind of the idea of this lower the dose initiative. In some countries, there's also, this is kind of an example of inconsistencies. Non-professionals are not permitted to hold animals, whereas in other countries it's preferred, so that way it's not the same person always being exposed. Also in the mobile procedures, we mentioned like stables. In some cases that might be stable boys. It might be young people that are assisting in these examinations. And so how are we managing those exposures? Who's trained to do that? Who's the responsible party? And then also I should mention that most veterinary facilities don't have a dedicated medical physicist like in human facilities. And then to that point, this paper I mentioned earlier from 2017 lists kind of a title of a person and then their particular roles. And then if you notice, like the radiation oncologist and veterinary oncology, they just have a lot. There's a lot going on. And then if they're lucky, then maybe there will be a medical physicist as well, but a medical dosimetrist, usually they don't have. And then a nurse and technician, just the list is longer for veterinarians. So again, we need to work within what's available. And then finally, these are kind of our summary points. We've expanded and diversified, and so along with the risks, they're more complex and challenging, and so the idea of increasing radiation risk awareness, knowledge, and skills is what we're working on. And that's it.
Thank you very much, Nicole. We have got a couple of questions. The first one says, considering LNT, is the use of more powerful radiation sources in veterinary stretching the definition of justification and wasting resources of relevant regulatory authorities?
In considering, sorry, I'm processing the question. Okay. The first part was considering LNT, and the second part was higher...
is the use of more powerful radiation sources in veterinary stretching the definition of justification and then wasting the resources of the regulatory authorities?
Lodewijk is a regulator, so maybe he can comment on that as well, if you want to come to the microphone. So I assume this means for humans, since we're linear no threshold.
I'm hoping it means in veterinary, but as we're talking about
like
veterinary,
the veterinarian.
Yeah. is the use of more powerful radiation sources in veterinary stretching the definition of justification?
I personally don't think so.
Neither do I. I think justification is justification, and the first thing you're looking for is like more benefit than detriment, and that's all. As for the second question, I can understand where the idea comes from, because that's what we have heard in a lot of other discussions in other fora. It's like, aren't we wasting these fine machines and this good time from dedicated professionals, and shouldn't we be treating like people instead of animals? Well, that's choices that society has made. If you are an owner of a pet, you want the best care for your pet, and you're prepared to pay even a high financial price for that. And if our society has accepted this as a thing that is valued, then so be it. It's a societal choice. It's not a choice of radiation protection as such. I don't think we can separate it out.
Okay, thank you. There's another question. Are there epidemiology studies on veterinary radiology, and is that needed to inform limitation? I'm not sure we're heading for limitation, but...
And epidemiologically, I'm not sure if it rises to the level of epidemiology. But there are some studies that I've seen. I'm not familiar with the breadth of the literature, but one of the ones I saw was specifically female, and I think their emphasis was on pregnant workers and just the risks associated with that. But we wouldn't expect it to be so different from humans. We would expect it to be different, not necessarily because of the radiation, but because of the other hazards and potentially unique hazards associated with veterinary medicine.
Thank you. Are there any questions from the floor?
Do you want to respond to that?
Oh, sorry, do you want to comment on that? Sorry, Lodewijk.
No, I'd like just to remind many of the people present here that a lot of the things we know in terms of what are the risks of radiation to biological risks that are induced by radiation. Before we had Fukushima and Nagasaki and a few medical exposures, all we knew about the effects of radiation came from the world of laboratory results on animal studies. So we know an awful lot about the effects of radiation on animals. If that might complement the idea of do we know or do we have epidemiological studies? No, we don't, as far as I know, but we know an awful lot about the effects of radiation, and not just on mice and rats. We also know a lot about the effects on non-human primates, on dogs, etc., etc.
Thank you. Are there, in the last closing minutes of this session, are there any questions from the floor? No. Okay. Thank you very much to all our speakers for this session.